And I want to say it's dire. I don't know why people are taking this thing lightly. I mean, when you look at the numbers there, about 1,000 active infections within the country. And the Delta variant is actually growing significantly and is becoming the most dominant variant. And we all know that the Delta, that one multiplies by about, 6 times. So we can assume, that of the known 915 or 964 active cases, it is very probable that we could have maybe 6 times the amount of infected persons. So those who believe that the active case figures are confined to 964, they could be significantly more. So in other words, we could have perhaps in the region about 6,000 Antiguans and Barbudans who may be infected with COVID. And when you get to that level, and it's going to multiply by an exponent of 6, then you can understand that within a matter of a few weeks, you could find maybe a quarter of the population, could be infected with COVID. And that is why we cannot afford to play with this disease. You see, our medical infrastructure is limited. And even though we have taken steps to expand it in order to ensure that, no one dies as a result of not having the facilities, one, it's expensive to maintain. And the other issue too, other than the financial, let's say, consequences and the financial constraints, our health workers, they are literally straining right now. I mean, they are under a severe amount of stress, and we can build out any amount of facilities. The reality is we cannot expand our healthcare workers at the same rate. It's the same set of people that we now have to stretch to also manage and to deliver services at the Secotwin Lake Medical Center. And we have to show some empathy to these people. I mean, it's 18 months now that our healthcare workers have been out there trying to keep COVID under control. I mean, many of them on the verge of, literally, burning out, literally. I mean, and you have to understand too, the stresses, the mental stresses and so on. We got to show a little empathy for them. If we didn't have any other choice, any arsenal to deal with, with COVID, I could understand, but we have tools that we can utilize. And even for the benefit of our healthcare workers, I mean, let us show some empathy and let us get vaccinated to reduce the prevalence of COVID so that we don't have the kind of strain on our hospital system. And at the same time, putting lives and livelihoods at risk.